Seems like my day.
Pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. I don't even know where it was.
Yeah, it did look like this. It's
Nothing about it.
up there, next to there.
First order of business will be approve the minutes from last week.
I'll make the motion.
Anybody moved?
Second.
Don't second it. Any discussion? All in favor say aye.
Aye.
Motion passes 5-0. Nothing in the consent agenda. No miscellaneous motions. First one up is Jeremy from the hospital. We're 5 minutes ahead of schedule. So I will give Jeremy just a little time. FYI, Wade is not here today, but if he said, if we need him, give him a few minutes heads up. That, and I will be gone on the 19th. Other than that, I had a conversation, I was gonna say it's a roundtable, I'll go ahead and do it now. I was speaking to Darrell at the extension office. He wanted to know if he can go ahead and bid out the demo of the existing area. Just get that out of the way, like short after the fair's over, just that way that part's done and gone. I told him, my opinion, it does need to be bid out. We had several contractors in county that would like to, I was sure like to have the opportunity to bid on it. So that's my advice to him. I just bring you guys up to the speed of, I'm assuming it's okay if he and I converse, because, that way if anybody's got any objections or anything, we can turn around the other way, or.
I don't see any problem with it.
That was my advice to him. I told him I'd get back with him.
I don't see a problem.
They also suggested that, and again, his building needs to be engineered, so that way all the contractors are involved in the same thing. That's where he said he did find an engineer, so that's moving forward. Jeremy, we're ready if you're ready.
Okay,
We're just running a little ahead of schedule.
okay, that sounds good to me. Good morning.
Good morning.
How's everybody?
Good.
Good.
Just wanted to give everybody kind of a monthly update on things, how things are going over at the hospital. We had our monthly board meeting just last week, so a couple of projects that we're wrapping up. We're still working on our electronic medical records project that I've been telling you guys a little bit about. We've had all of our vendors do demonstrations, and we're in the process of selecting which one of those vendors that we're going to end up going with. And if you guys remember, basically the company that we're using right now got bought out, purchased by another company that the hospital used to use and then switched and gone away from. We did have that vendor presented as one of the 4 vendors that came out. And we're going through that selection process right now. We're actually getting pricing information on all of those 4 vendors. I think most of them know we're dealing with companies that cater to the smaller hospitals, like critical access hospitals like us, community hospitals. So they know that most of the hospitals our size don't have millions of dollars in the bank to pay up front, like some of the hospitals that, the larger ones that they deal with. So with that being said, these companies kind of expect their analysis or their project to be a monthly cost and they usually will take it over about a 5 to 7 year period. So these companies have outlined our expenses based off of monthly expenses. What I've seen them so far coming in at is around like the 7 year mark is what they would like to have, like a commitment of 7 years to be able to pay for their project. That usually will cover both the maintenance agreement, anything that goes wrong with the systems, as well as like the licensing and all those fees that are associated with using their product, training and all of that. One company said that they would take theirs as far as going out 10 years, which is a pretty long commitment. Not knowing, what these companies might do from 1 year to the next, kind of a crapshoot if we're gonna be able to stay with that company. I think we've been with this one for around 7 or 8 years. And then a lot of them are getting acquired by larger companies, so you never know what's gonna happen. Yeah, go ahead.
Why, you had the company that you did away with because you evidently weren't getting along, and you went to the other company. And then they got bought out by the other one. Why would you even consider the one that bought them out?
Mainly, the fact that they had come to the table and said that they had changed their product. So we did have them come to the table knowing that, but we did have in the back of our minds that they were a company that didn't work well with us as well. So kind of just doing our due diligence to make sure that it was in fact what we thought it was, and to be honest, of the 4 companies, they're the first one that we took off the table just because of that reason. So they basically confirmed that they hadn't changed from the time that we had used them before. What we're seeing is probably going to be around a $40,000 a month commitment on the EMR. So that is something that we're going to have to incur as an expense. And currently we're paying less than that, but it's one of those things that the hospital has to have. Between the payroll systems and the electronic medical records and the HR, I feel like our systems that we've got right now are not as productive as what we could be. And between our financials, running our income statement, and running our payroll process, our staff spend a lot of extra time that I think is a little bit unnecessary. They're doing a lot of manual processes. And my hope is with these new systems that they're going to be able to spend a lot less time calculating manually some of these things.
Is there a cost of paying the $40,000? Is there a cost savings to go along with that? That would reduce the ultimate cost of that thing?
Yeah, I mean, I think the efficiency would be the biggest thing there, that our staff are not working 6 and 7 days a week. Most of those staff that are doing that though are salaried. So
there'll be no
there's not savings on their end, but there are some positions that in the long run, we probably will not end up needing because of the efficiencies that these will create. Probably more so on the billing side is my guess.
So you're talking about approximately $480,000 per year for 7 years.
Yeah. But it is something that we do have an expense right now with health plans and.
That's what I was gonna say.
Yeah.
You're gonna be offsetting something.
Yeah. I mean, we're gonna get rid of some of our current expenses that we have, so that's not an added expense. Yeah.
It's not totally. What are you paying now for your service?
Between payroll and electronic medical records, we're gonna have a breakdown of everything by when we do the analysis, but just for the EMR, because this 40,000 is EMR, so I won't compare apples and apples, but, we're more so in the 15 to 20 range, so, yeah.
Can you negotiate a little bit longer contract
Yeah,
for a little less price?
yeah, I mean, and that's the thing, I think, is if, you know, I was saying about a crapshoot, if the company gets bought out, I mean, I don't think you're obligated to continue that contract if they get bought out. Basically, you're just paying a monthly service fee to have that product, similar to like what Microsoft is doing now, where your Microsoft licenses are, instead of paying for it and buying the license up front, you're paying a monthly fee on those, so.
Where you got a service agreement, if they do updates, well, can't they automatically update you? I know our software system that we use, there was you had your helpline and blah, 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 all this other stuff, all the icing on top of the cake. But if there was updates that come down the pipeline, then if you was in their service agreement, they would send down, you'd have to do a JBoss reboot and pull all the updates down to your, because we owned our own system, but we're still paying for the cloud. And so we could get updates. So 5 years goes down the road and they have a big update coming along, then you get the newest.
Yeah.
The newest. And then you can still go back and cancel your service agreement at the end of your contract or whatever, and then just pay for an upgrade, which is a whole lot cheaper than the $40,000 a month.
Right.
For 12 months.
And that's kind of some of the conversations that we've had at the board level is, you know, how much of that is your maintenance agreement, how much of it is your licensing that you're paying for. So at the end of that 7 years or whatever it is, you would drop off some of those costs for the licenses and just pay like a maintenance agreement for your upgrades. And these systems probably do upgrades more like maybe monthly or every other month or something like that.
Now, are you gonna house the servers or is it cloud?
This would be all cloud, all the vendors that we're looking at, so. Yeah,
That way you don't have to go buy $100,000 worth of servers
Yeah.
to.
exactly. And, so with some of the things that we use, you know, I know that the internet speeds are getting upgraded and bandwidth and stuff like that, so, and through the, coffee can that we're part of. So that will help with everything starting to go through the internet. That'll be nice to have those, you know, that reliable internet speed.
Until it goes down.
Yeah. Yeah.
Until somebody pours a hole through the fireplace.
Yeah. So, for the month, just to give you guys a quick update, the hospital did a little bit better than what we had budgeted, but we are still showing that for the month we had an operating loss. Year to date, our operating loss is 1.8. We had budgeted the operating loss to be at 2.3, so we're a little bit less than what we had planned on. We still have that PPP loan forgiveness that's on the books for other revenue, which was 2.7 million, and HHS CARES stimulus money of 1.5 million was recognized in this fiscal year. So we do have some money on the books this year that is helping us. One of the things I wanted to update you guys on was that 6/30 deadline, that June 30th, to spend all those CARES relief fund stimulus money. We were able to almost spend all of it. I think we were out of 2.1 million. We got up to about 2 million that we were able to spend on things that were COVID related, things that we could justify with our auditors that we were either preventing COVID or caring for COVID patients when they came in. And so things like infection control, cleanliness, sanitation, things like that. So we're able to update quite a bit of our capital equipment with that money, and a few upgrades on the hospital, as well as the 2 remodeling projects that are going on over at the clinic and the ER. So those projects are still ongoing, and we have basically been able to cut checks to those vendors in anticipation that they'll get done within the next 6 to 8 weeks is basically the timeline. Some of the projects are complete or in the last phases of being complete. The 2 remodel projects are probably the largest of all the projects, and they've got the walls up, mudded. Some of them even have coat of paint on them. Some of the things that delayed those 2 projects were specialty doors, things like that were like 12 weeks back ordered on and getting them in. So that will delay that project. And our builders have done a really good job of making sure that whenever they don't have work to do, that they're going to other projects around the surrounding areas, so that they're not incurring expenses for us as, just standing around not working. So that's been a good thing for us, the partnership with the construction company that we're using, Vital Construction. And they've done a couple of other projects for us with our radiology. So we're pleased with the work that they're doing.
Now, I just understood that you said you're 1.7 million in the hole in 6 months,
Operating 1.8, yeah.
1.8 million. What can a person do to try to pull that number down? Is all that claims that's not being paid?
Well, I mean, that's part of it.
That's a
Yeah.
lot.
It is, and a majority of the hospitals in the state of Kansas are operating losses, which is one of the reasons why we have so many hospitals in Kansas that are quote unquote in jeopardy, or in danger of closure. And that's basically staying without outside funding, either county assistance or some sort of tax appropriation.
I think beforehand, when you was up here and we was talking about the budget and everything, you was gonna get us maybe a report of your satellite, what was taken in, what was the expense. Do I remember that correctly? So we could kind of look at, you guys can kind of look at what is it just the hospital that's,
Right.
or is it something else that's draining the piggy
Yeah.
bank?
Yeah, and so, and that would be on the departmental reports.
Yeah, departmental foot, they were gonna supply, I haven't seen that on yet.
You haven't gotten the departmental reports?
No.
No.
So I think Juanita was sending that to you guys, but I'll check on that. I thought you guys had written them that day.
We got a 2 or 3 page report
Okay,
3 or 4 weeks ago, but it was not, to me, it wasn't departmentalized.
okay,
And so I probably didn't look at it quite as good as what I should have, Jeremy.
yeah.
And and I don't even know if I should ask this, but I'm gonna ask it, is the department head salaries public information?
Well, I think everything's public information. Whenever you guys see the departmental financials, it will show line by line, it'll say like salaries, then benefits, then all of the supplies, all categories.
No names, and
Yeah.
just give this
Yeah.
department, this
Yeah.
position, so on and so forth.
Yeah, and it won't go down to the level of position,
Oh,
even, it'll be lumped all together.
Oh, okay.
But, yeah,
Would be a number of employees counted on there?
we can get a number of employees that are in each department. That would be kind of a separate calculation that we would just tell you how many employees work in those departments, but yeah. And what I was just gonna say is, what I've seen in the past of working in healthcare, that a lot of the clinics, if you can break even at best, then you're doing well. The clinics typically, our feeders for the hospital. You know, the doctors will send patients in to do lab work or x-rays, whatever it is that they're there in the clinic for. But because we're cost reimbursed on our clinic side too, it's beneficial to have some of our costs for physician salaries or staff salaries in those clinics because of that cost reimbursement. And that's what we call a rural health clinic. And so rural health clinic is cost reimbursed similar to like a critical access hospital is cost reimbursed. So that is helpful that, that the cost is going into there as opposed to like the emergency department, which is a very low reimbursable department. I know it's complicated, but whenever we run it through on the cost report, all of our reimbursements are going to be adjusted in a way that reflects our cost in that department based, and then they take into account how much Medicare patients that you have too. So we're a little bit unique in that we don't have a ton of Medicare percentage. A lot of the smaller hospitals do have up in the 70-80% Medicare percentage. We're a little bit lower than that probably with our age of our population, our community.
You had mentioned your budget for the first 6 months was negative 2.3, although you ended up with 1.8. What's your budget for the last 6 months of this year?
And that was actually through May, so that was
Oh,
first.
through May?
Yeah.
What, June, so the first
Yeah.
5 months?
Yeah.
What's your annual budget?
Well,
They continue to stay in the red?
yeah, I mean, these are basically well, 5/12 is what that is. It doesn't change through the year. It's not like a
So that
seasonal budget.
2.3 is for a 5-month period?
Yeah,
So you're looking at a $5 million budget loss for the year.
operating.
5.5.
Operating. But by the time that we plug in, and you have to remember that 2021 is a year that we got, $3 or $4 million worth of outside funds. So from the HHS and PPP funds and stuff like that. So I don't anticipate that future years will be this large of an operating loss. That what we brought last month on the tax budget was about a $2 million to $2.5 million operating loss is what we would expect on an annual basis at this point in time.
Is your patient level now currently, and I know every year changes, is the patient level back up to the 219 level?
On the inpatient side, it has shown that it is getting back up there, and we've been pretty steady as a hospital patient census can be. What the clinic side is where I've seen a little bit lower than our normal numbers in some of our ancillary services, but.
Your outpatient service, though, that's not where your big bucks are at.
Right, yeah, I
Big
mean,
bucks is in the hospitals.
yeah, dollar wise, yeah. So the hospital numbers are up above
Up above 219 level?
above where we budgeted and about where the 219 level was. Yeah. We had budgeted a little bit lower than 2019, anticipating that after 2020 that there would still be a little bit of a lag, but we're doing better than what we anticipated. So I will go back and make sure that you guys have those departmental financials in your hands, so that you can see those. And I was under the impression that you guys got those that day. So I'll talk to Juanita.
We got a 3 or 4 page deal, but it wasn't, the breakout is
Yeah.
what I think we probably should have done.
Okay. Anything else that you guys would like to see right now? Other than that, I'll make sure that you get that. And
Appreciate your
Yeah.
continued updates, Jerry.
Yeah.
That's something, and I think we need to keep that line of communication wide open as you're doing, so.
we'll appreciate y'all's support as well. And if you guys need anything, feel free to call. All right.
Thank you.
Yeah, thank you.
Morning.
Oh, yeah.
Yes.
Wayne,
Good morning.
morning.
Good morning. A few handouts.
Oh, I do not have that zoning permit, so those ones zoning permit, I didn't have it, so I don't know if you want to.
Okay. Might pass that around. Just did.
That's what he's got to get past.
This is the new report, basically changing the motion,
Oh, okay.
mostly.
We haven't,
I'll just pass it around because it says in the book that there was one zoning permit.
okay, didn't have a copy at the time. Okay, I see. So you pass around the zoning permit that was not available at the time to prepare our books last week.
Looks like just putting in a lot of them on that particular one.
That's a new motion or just worded differently?
Yes. Yeah, it's really what it has to do with funding. Has to change the funding.
And here's an update. For this motion.
Okay.
Okay. Thank you. They put a new home up there where they currently live.
I'm not for sure on the details onto it, Don.
I'm sorry.
I'm not sure on the details onto it.
They moved their house over a brand new basement.
That looks like a new modular home.
Looks like a home.
Yeah. This would be special issue checks. And the checks are in the back, and then also Karen's copies back here too.
Okay.
I get, either way, however we want to get those to Karen and Jessica.
Okay, those will go around and we'll get the names.
Probably just-
Okay. Okay, so let's go ahead and get started on the engineering report. So, one road permit just handed out. What it is Evergy's putting in some gates and entrances on Dobbin between 2 and 3. That's in the road permit. The zoning permit, as you have, I just had that one copy going around for the modular home we just discussed. The other one would be a motion for a used wheel loader, and then I have a couple talking points. So, sent around basically the revised motion. What that amounted to was where the funds were coming from. And so, then at this point, it would be just discussion about that loader. And so,
Are we replacing something, or are we just adding?
that particular one is we're replacing, actually it started out for last year. That's where the funds are gonna actually come from. We asked to encumber the funds. They were encumbered into equipment reserve. That's where the motion basically is very end.
this equipment reserve. We started out with this was a yard loader. And so, a yard loader meaning basically this is our salt loader. This is the one that's been in the salt pile. We have over 6,000 hours onto it, 6,667 hours on this particular one. It's a Komatsu. We're replacing it. As I say, it's been several months in the working. The folks, the staff, had went out and visited different models to try to come up with basically the best selection. And so with the best selection as I come today is basically the Caterpillar, and this would be the 926M wheel loader. And we looked it up as well as far as pricing. Go on the internet, check pricing such as that. The prices are all over the place, but the one thing that you're going to get with this, as far as this Caterpillar loader, is you're getting equipment that came out of the rental fleet, so it was maintained during the process, and so we know the condition of it. We know the operation, how it was operated. Now it is subject to final inspection, but that's the recommendation as you see with the motion. It will also come with a warranty as well. And so
What kind?
on this warranty, it is an extended warranty of, let's see. We still have the existing warranty that's up to 12, 17, and 21. And then we're going to add 2,500 hours, or I'm sorry, we're going to add 24 months or 1,000 hours to this warranty. I believe that's what I have.
It says 1,500 hours.
2,500 hours. I'm not.
For
It
for
doesn't
2
say,
additional years.
Yes.
it doesn't say anything about months either.
What's
It
that?
doesn't say anything about months either, it just says 2,500.
2,500 hours, or that, I'm sorry, it's 12, 17, and 23, or 2,500 hours. So which one ever comes first is kind of how they're doing it.
Have 2 years.
Yes. And so, but the existing warranty is actually up in 12, 17, and 21. So the existing warranty on that particular equipment would be up at the end of the year.
So you're buying a used loader with warranty still left on it.
That's correct.
But
And
your
then we're-
extended warranty
Then we're
starts the
adding
day
an
you buy it.
extended warranty, yes,
It starts the day you purchase the machine, though. The
for the
extended-
hours that we currently have on it, that's correct.
It doesn't run until the end of the month, or the end of the year, and then you extend the warranty.
Who's this from?
This would be Caterpillar,
Do
I
we
believe
not
I have on that.
Foley?
It's Foley Caterpillar.
Do we not need that on there where it's coming from? There's no mention of whatsoever where we're purchasing it from.
We have Caterpillar on the motion.
Got 2018 Caterpillar.
It says it's a 2018 Caterpillar.
Yeah, I believe you're right, Bob.
Doesn't say where it's
We
coming
want
from.
to bring it from Foley Caterpillar.
Is that out of Chanute?
Archie, our salesperson is out of Chanute. So as far as where the piece of equipment's at, I'm not for sure.
So are we trading the old one in?
Well, yeah.
The old one, they were only going to give us a trade-in of $7,000. So we decided to hold it at this point. And
What are you
we
gonna do
decided
with it?
Is this
What are you gonna do with it?
well, at this point, at $7,000, we figured that really wasn't much of a trade-in.
Not at all.
So what we'd be looking at is possibly going maybe the auction or one of the internet auctions. Would be do something like that.
Is it still usable?
It still runs, there's not much left to it. I mean, they're
It is
only
used- it is
offering
runnable.
$7,000,
It is
so,
runnable.
I mean, just under 7,000 hours. That's good.
I don't know where we would stick that Foley cat.
I was gonna put it up there at the end, model 926M wheel loader from Foley Caterpillar.
I don't care where we put it, we just need it in there.
That's where I'll add it in.
Now, they add forks on this as well, and they're adding also flat hooks onto it as well, so these are things that just being added to it. But yeah, you're right, but we need to put in Foley Caterpillar.
That's where I'll do it, right there after the model 926 wheel loader from Foley Caterpillar, current
You got that,
45 hours.
Denise? All right, thank you. And once again, the funds should be coming from equipment reserve.
So motion 2021-44, based upon the recommendation of the county engineer, and approval of the county attorney to waive purchasing policy as competitive bidding for good cause, said cause being availability and market, to specify a used wheel loader as replacement equipment as best bid through extensive evaluation for one used 2018 Caterpillar Model 926M wheel loader from Foley Caterpillar, current hours 1,045, with added extended warranty powertrain and hydraulic until 12/17/23 for 2,500 hours, and added forks and flat hooks in the amount of 149,500, and direct the county engineer to sign all documents related thereto, funds to be paid from the equipment reserve fund.
I'll move
Oh.
Attorney.
Jesse moved,
Second.
John seconded. Any further discussion? All in favor, say aye. Motion passes 5-0. With that being said, I mean, we spoke last time you were in about, you had a crane that hadn't been used in quite some time, you got a
The pug mill?
pug mill, you've got, I don't know, do we, as a commission, need to take a walk through to, I mean, with you to, one afternoon to say, I mean,
We sure can.
would think
I can
the crane
definitely bring the
sitting there would be
information.
losing value,
Every year it sits there, it depreciates.
Yeah.
so I mean,
Now's a good time to sell stuff.
Yeah, it
yeah, I
is.
mean, we just need to maybe get, I don't know, we have a list of things that,
I'd like to bring a list to you. I can bring photos and different things like that and talk about what we're doing or not doing with the piece of equipment. The one thing that we have, which we have not done at this point, is actually do an internet auction. We have not done a Purple Wave auction. So this is gonna be a little bit different, or Big Iron, yeah. It's gonna be a little bit different for us. Otherwise, all of our auctions have been basically the local auction, the annual auction that we have, which really wouldn't be a
would not be a
Fitting for
good
this.
fit, I would think.
agreed. So, we'd like to bring that to you and then be able to move forward on it, so that'd be fine.
Yeah, I would say the sooner we can move on, get rid of some of these items that you no longer use.
Bring us a list in 2 weeks.
We'll bring you a list in a couple of weeks. Okay, we can do that. Just trying to find a few other
I might
things.
check on Big Iron too, see what their commission is on that. I don't know. That was done like an 8%. I don't know if that's a buyer or seller's premium.
Well, and I think there's also some government too, where they don't charge
They might.
a commission on it.
There's also another company out there that's used
Purple Wave and Big Iron and,
all certain time.
maybe auction time.
Ritchie Brothers,
Yeah.
Ritchie
That would
Brothers
be-
will have to go to, probably Oak Grove.
They've been doing some of them online and in spot, so.
Well, we can check on that. If you have some insight on those internet options, let us know. But where I would see that we come in is to actually list the equipment, get approval for the equipment that you'd like to put on an auction. Then we'd have to decide which way we're going to do the auction by motion. And then if there's any terms to that auction, that'd have to be part of the motion or agreeable to the motion. So we go from there. And so if there's multiple sites, we just have to find out what the terms would be. But, okay. Good work that. There's just a couple of things. One thing would be to report, we do have some extra costs on one of the, basically our blades. It's a John Deere blade. It's a 770 GP. This is the one that Chris Gifford uses. Basically the one that has electronics onto it. So what the additional cost is it's $9,000 that wasn't paying to Murphy, so sometime soon, what you'll have is basically a voucher for over $9,000. This is the one that we had the transmission put in. So we put the transmission in, and then there was a lift problem with the motorboard. So the valves, the hydraulics on the motorboard, there was a lift problem, so we took it to Murphy, had them take a look at it. And so then at that, we already had the parts for the seals and the brakes. And so we give them the seals and the brakes. We were already working on another blade that we already had in the shop. And so by them putting the seals and the brakes in, they also found that basically that differential was leaking. So they were fixing the seals on the end. So it all, you know, from the shop, it basically started from one, and then we had additional costs. So just under $10,000 is what we had. So just heads up on that one. Okay. The other one is, make sure I got all the talking points. And that was repairs on B001. Okay, the other talking point is patch repair. And this would be what we call the Lake Road, 16th Road. This is one over there by Neustron. This is the project that Bettis is doing the asphalt overlay on. This is the section that goes up to Jacobs Creek, Reamer's Point. That goes up to Reamer's Point. And so this is also the section that basically the water, and actually it was inundated here last week as well. And so the water continues to go over the road, say if we're going to concrete it or not concrete it. Just the patching alone, now we haven't looked at it after this last rain, which was just here last week. Haven't seen what the condition is at this point. But the initial patching, where we were getting an estimate, is they said that they could patch it for just under $3,000. It's $2,920 to do that patching. And so what that amounted to was a 4 foot by 100 foot, a 3-inch patch. It included the milling, and it also included all the work to put the patch down. The project itself, if you're looking at about 700 feet, the project, we laid the asphalt onto it as we had planned in the project itself. The 700 feet would be $11,600 at the price, the current price of $75.60 per ton. At this point, really the question is, are we going to come back and do a permanent fix onto it, which I would recommend concrete, or are we going to go ahead and make it safe? And that would be to patch it and then make it safe, put an overlay onto it, waiting for the time that we actually put concrete on. It's not to say that it's going to stay there, because we know that that water is starting to lift and basically destroy the asphalt. It's starting to get underneath it. It's starting to lift it. That's the reason why we have the repairs. So if we put anything down onto it, say we fix it, we put the $11,000, we put the $2,000, we put somewhere close to $15,000 onto it. It's not to say that it's going to last a year or 2 years, but at least we'll be safe for a year or 2 years for the most part. Just depends on how well it lasts. But the permanent fix, once again, the recommendation would be concrete. Now, why does concrete make it permanent? Is because we would tie the embankment, the water side, with concrete as well. So we would actually put what you'd call a concrete apron, a concrete embankment that would be tied into the pavement surface. That way you would slow the ability for that water to get underneath the concrete. For the most part, the water should not be getting underneath that concrete. The other side is the concrete will add structure to the pavement. So if you do develop voids, there will be some structural strength that would go with it as well, because it would be reinforced.
Is the base good enough to put concrete on?
I believe it is.
What's the cost of the concrete part of it?
That's where Tom and I were just kind of spitballing some numbers. So you're looking at probably over $250,000.
Can we raise that road?
No, not necessarily.
Probably not without raising that bridge, I assume.
What you're going to find is it's a low water crossing. And so the elevation of the John Redmond affects basically that road. So once the elevation of the road goes up, it affects it. So if we raise the road, then we're also going to raise the level in which the John Redmond's flooding. at that certain point.
Is
That makes
that
sense.
road used a lot, or have we,
I believe it is. If you talk to the folks that go to Reamer's Point, I imagine most of the traffic goes through, 16th Road to go to Reamer's Point. I don't believe you're gonna get that much traffic that goes up to 17th and comes back down.
Be a school bus route too.
So you're gonna have all of that. You're gonna have traffic, school buses route, school bus route. But the other side is too, the concrete, I believe that we would also have potentially some funds or grant that might be available. So that $250,000 that I'm referring to may not necessarily be all of county's cost. And so what we could do there is we kind of position ourselves to say, well, let's make a project out of it, and then let's just shelf it until we basically get some shared fund,
Federal funding.
federal funding.
Talking about 750 feet.
Because there's some FEMA money potentially with a grant, because you're doing a mitigation type project. That the mitigation meaning basically repair, now you fix it, you won't have as many repairs. The other one is also basically it's a route. I'm not getting the name of it correct, but basically the Wildlife and Parks has a grant for routes that go to the Wildlife and Parks area. And so there's possibly some funding there. And that's not even looking at KDOT, that's just basically the federal side.
Is there a certain thickness of asphalt that would not flip up? Instead of doing like a 3-inch lift on it, do a 6 or 8-inch lift on it, would that help?
The key is where the asphalt is binding to the surface.
To the original road surface?
So regardless of whatever thickness that you may have, if you get separation or no bond, then you're gonna lift that asphalt.
I know, I mean, it's really not currented. It's just the waves that's hitting it, isn't it?
Yes.
There's not a current that runs through there.
No,
It's
it's
just
not.
backwater flood.
It comes up very slow,
Yeah.
but as basically the wind hits it, it hits the shore.
That's why I just didn't know if a certain thickness would stay in place versus a 3 or 4-inch asphalt.
Not so much, because as the water continues to break that bond, it also will degrade that subgrade. So the key is you gotta get the water out of there, so as much as possible, you need to prevent that water from coming up underneath it.
Could a person drive guardrail down and make a barrier to keep the wave from hitting it? Like come up with put the guardrails side to side and make like a fence to protect that?
We did that over there on the Lebo Lake. We actually had drove down some sheeting there on the north side. And so we had a lot of erosion embankment, basically. And so we drove down the sheeting there. That is potentially what you could do as well. But that will stop the waves for the most part, but also doing this with concrete, that's the idea of it as well.
Right. Well, I mean, I'm sure the sheeting would be a whole lot cheaper than the concrete. By the time you factor in your patchwork and then your overlay that's already been bid out, and then you go in and tear that out, then put your concrete and put your apron on there, I think it'd be cheaper to drive the sheeting in alongside to make a barrier between the water coming in and just a thought.
It'll make a barrier, but it won't stop the water from coming underneath the asphalt. As the water sets there, you could place the sheeting that you might stop some of the wave action, but it still doesn't stop the water from coming underneath. The idea on the concrete is you make it monolithic with the embankment and the pavement itself. And
Yeah, I
so
understand that theory.
that would be the idea. The one thing you could do though, is you could take that sheeting and actually drive that sheeting in addition to repairing the asphalt. You repair the asphalt, you drive the sheeting, you'll make that pavement last a little bit longer. It's a temporary fix.
I just don't know what to do once the water went up over that sheet.
Once the water goes over that sheeting, it depends on where the wave action is at. But it's still, the water's gonna go over that road, because that was wet water several feet at the end of the day could be over that road. And it'll just sit there, but concrete for the most part will handle itself, underwater. I mean, I see it all the time. So that's where we'd be at. So the idea on this is moving forward is to say, go ahead and make the repairs. I like the idea of the sheeting. We could actually add that, but it won't be right now. It'll be late fall before we get there. And I'd still have to get approval from the Corps of Engineers to make sure that we can do some sheeting on that. And so we could fix the road and then basically make the shelf ready for whatever grants that might be available. But there's no guarantee on the grants. It's just to say, I think there are some opportunities for the grants and to basically share that $250,000 cost.
Well, it's gonna be an ongoing problem if we don't fix it.
Yeah, I was just wondering about the slope protection deal and then your asphalt. I mean, with that, I mean, you got your slope protection, mid concrete, and your asphalt's below it. I mean, it'd almost be the same as your sheeting. Yeah.
And we
Would help economically somewhat, but.
And we have done that a little bit. If you go out there now, you'll actually see where we had placed some riprap and we concreted all that embankment up. Was it covering the lip of it? No, it was not. But it had held in place for quite some time because we were having problems with it, I don't know, maybe 6 years ago or something like that. And so some of that work's been done.
Oh, and all the problem is that wave action, when it gets a certain height, it just eats at it.
Yeah, if it can go underneath and break that bond, that's where it lifts that asphalt.
Basically, you want to proceed with patching, is that correct?
Mine would be to having the discussion to go ahead and proceed with the project, go ahead and proceed with the patching, go ahead and proceed with the overlay as we had planned. And then with the idea that within 1 or 2 years that we would have a possible grants to do a more permanent type of repair onto it. That's just a
I
discussion.
mean, it's been there for decades. I mean, it's lasted this long as it says, am I correct? Bob know more about that.
Well, yeah, and here's my thought, and I'm gonna say the same thing about Highway 50. It's been there for decades, it's been usable. Instead of, just because we're getting a grant on Highway 50 doesn't mean that we have to always take a grant and spend the money. And we're spending $850,000 just to match a grant for 7 miles. To me, this project is more important than Highway 50. Highway 50 is passable. Why couldn't we take that $850,000 instead of doing all the overlay and everything? Let's try to get on with the Corps of Engineers. Let's go in and do the project right the first time instead of going in and spending a bunch of money and tearing it out and doing it again.
It's always interesting on Old Highway 50 how it gets brought up that way, but the high-risk rural road application, basically by consultant that had came through and done a safety study throughout the whole county, and identified by the numbers of the risk on Old Highway 50. Now, it may have been only 20 foot wide for quite some time, but the study was clearly stating that basically it met the need to be repaired. And so as you're looking at 30-some applications in the state, we also received the highest grant because we met the highest need, all right? So there may be views to say we don't need to spend the money on Old Highway 50, but the state of Kansas, the Department of Transportation, the federal highway guidelines basically states that it was a high approval for replacement funds, $2.35 million. So they thought it was serious enough to basically fund this project. That money is not transferable to any other project, okay? It stays on that project. The other thing I'd like to point out too is Franklin County also recognized Old Highway 50. So right now they have a request for proposal for widening Old Highway 50 on the Franklin County side. So those folks think this is important as well.
I would like to add that 2 weeks ago, it was I-35.
Yeah, that was a one-time deal, but even if we spend this 2.35 million plus our 850,000, we're only looking at 7 miles of a 27-mile road. We still got 20 miles left that we're eventually going to have to do. I think our priorities maybe not be in the right situation.
But the question on 16th Road is to say that if you're in agreement to be able to move forward on this asphalt, Are you okay with basically, going ahead and doing the overlay, doing the patching, doing the overlay on that section that gets inundated at this point? Otherwise, the discussion was to close the road.
I don't think we need to be closing the road.
I would say,
You had that overlay already slated?
Yes, sir.
Okay.
Yeah,
And so the
project,
patch is just an extra 3,000 out of the budget then?
yes, sir.
All right.
That you would have to approve at a later date, maybe in a couple of weeks. We'd have a change order for you.
But again, that overlay was already in the construction
Yes, sir.
process, okay. So I don't see a problem with proceeding ahead. Everybody's got their own opinions on Highway 50. I think it's a plus to get that money from KDOT and build it towards what it should be.
Mhm.
So
Okay.
I'll move that we
do the patch.
do the patch on 16th Road.
What I'll have is a change order that'll come in 2 weeks, and then we'll have a motion for that to approve the change order,
Good enough.
if this is okay, and then we'll have a full motion on it, but I appreciate it, thank you.
Agreed.
I believe that's all I have at this point. So construction zone is just to let you know that asphalt up there at Lebo, will actually start, this Thursday. And so that's from Apex Shears. They're gonna be doing the milling on Wednesday. That'd be the milling over the, bridge, at the lake, the Lebo Lake.
Oh,
So we're gonna be milling that portion of it. And also, Bettis is starting about the middle of July at this point. I don't have an exact date. Our chip seal programs, not to say, it's set in stone, but approximately the 19th is when we plan on starting our chip seal project. That's over 43 miles, that we have. We already have the road permit and then also dust control. They're actually laying down the dust control now for at least one resident that we had, and then there was a couple other locations that we're trying to catch. But folks that did not meet the deadline, we tried to accommodate where we could, but it was very difficult even getting Scott Wood back here at this point. And one of the checks that you have, actually a special issue check, because I think it's over $59,000, and that's for the dust control. We've already received funds from payments from landowners over $53,000, so that's taken care of. And on Matthias, as you'll see there, that every effort's been made to basically make that a priority. And so
I've seen those out there working this morning, so.
and we should have 3 excavators out there, 2 in the ditches and then 1 working basically the pipes. So we're making every effort to get that one finished up. We had a call out on Monday, 7th and Homestead. This is basically some hay bales. So 2 folks were called out to take care of some hay bales that were on fire. So,
I seen something on, I think it was Coffee County site, that there's something going on the east side of Lebo around the curve.
yes,
When is that?
that's part of this project.
That's part of that's same as the west one up by the lake?
Yes, sir.
I didn't see anything about the one out west of town, but I seen the one about being east of town.
Yeah. And I didn't
That's
put plans onto it. I just, what we have there is we're gonna actually put a penetration oil right around that curve. And so we had to notify the landowners because there was just no way that you could place the penetration oil without the folks driving on it. And so when you're putting oil on gravel, they're gonna track it up. And so we're trying to prevent that. So we're giving notices. I think they had placed letters at the doors and such as that. So, if you have any questions?
I do not know. Anybody else?
No.
Okay.
Thanks for the update, Wayne.
All right, thank you.
Thank you.
Well, just keep in mind, we may disagree, but we also agree too. Okay? All right, all's good. Thank you.
Run a little behind, Karen. Sorry about that.
That's okay,
Bobby?
it happens.
Yep.
Good. Good. Sorry you're working late.
It wasn't Wayne's fault.
Putting in the hours. They're gonna get paid extra for that.
This is, that I'm handing you is just kind of a list that I am putting together, and talking back and forth with, Phil, the auditor.
Thank you.
Uh-huh. All right, well, I have some news for you. I'm here today to notify you that I have taken a new position, and my last day for Coffee County will be August the 6th.
All right.
I'm going to be starting with CIC the 2nd of August, but I'm planning on staying here until the 6th so that I can finish out end of the month reports for July, get the new Waynesville real estate and the quarterly report to the newspaper. I'm going to work evenings or early mornings and make sure that happens. I have mailed my resignation to the governor, and I will be giving a copy of that letter to the county clerk later today. As I said, I have been in contact with, we had talked last December about during the transfer from one treasurer to the next, having an audit done. I had asked to set aside money, and you guys said no, that the county pays for that audit. So I've been working with him. It's not really an audit, but for lack of a better term, we'll use that. He calls it a letter of understanding, where he comes in and does exactly what we ask him to do. I will be bringing that letter. I'm hoping that him and I can get some things finalized this week. He's been pretty busy with budgets and stuff this time of year, but I'm hoping that maybe him and I can get together and get things finalized for the schedule. Like I said, I'm providing you a list. I've provided you a list of the things that I feel need to be done. But obviously you guys are the ones that are going to be signing the letter of understanding. So if there's things that you feel need to be on there, I can add those to it. If there's things that you don't understand why I put them on there, let me know. We can discuss that. And I will tell you that I did try to pick the things that normally when they come to do our annual audit, these are the documents or the documentation that they usually request from the treasurer's office.
That's what I was gonna ask you. Have you visited with Phil? Has he supplied any other documents that need to be prepared on the?
He hasn't, I mean, him and I have been going back and forth on this. I've given him the list. He said, okay, I need to know a little bit more about what you want us to do exactly. There are a couple of things on here that we don't normally do, a cash count, and I just want that to be verified because we always do have extra it's not just what we daily take in. We have change in our office that we obviously give out. So I want him to do a cash count, verify that that's what is physically in the office. Last I talked to him, he was looking at probably coming in the last part of August. So, the last part of July. So there will be a time that I'll still be here after he's done this, but at least we know everything was where we expected it to be up until then. So is there anything that you guys can think of that you would like to see on there? The other thing I put on here, not just cash count, was the tax sale. I want to have a clear computer list and a list from, I'll get a list from the attorney's office that states this is what they're showing. Yes, this is what I'm showing. So that will be known.
I can't think of anything myself right off.
Okay,
But
well, like I said, I'll
but
be continuing to work.
That
with
don't
him.
mean anything.
You know, I'll continue to be working with him. I sent him this list midweek last week with 4th of July and everything. I didn't expect to hear from him until possibly sometime this week. The only thing, as you can see, I had that, I didn't have share concerns. He normally will come in and ask, you know, is there anything passed through the office that you have concerns about? things like that, so I wanted to make sure that he, him and I discuss anything like that too.
You know, to me, the things that need to be reviewed and discovered, we need to let Phil provide us with everything that we need, you know, not only for you, but for us too, so.
Right.
And since you're visiting with him once a week or daily, you know, two of you work together, I'm sure we'll come up with everything that needs to be disclosed.
Right, because this is he calls it a letter of understanding. Basically, from what I gather, we tell him what we want done. So, like I said, that's why I'm coming to you to see if there's things that you feel you want more information on, or that you want to know is in place, or whatever, so that when you sign off on it, because the items will be like in a separate schedule. There'll be the letter of understanding. He sent me a sample one that they had done with another county. I believe it was Woodson County, when they had a change, when their new clerk came in this year, so.
Well, and your original departure date was,
It was gonna be in October, second Tuesday in October was when the new treasurer takes office.
okay,
So
so he'll be taking,
that is completely,
Is he aware of your date?
no, I haven't spoken to him. It'll be a matter of, from what I gather, I notify the governor and I give the county clerk a letter. Then she contacts the Republican Party, and then the Republican Party will have to appoint someone to finish
okay,
these last couple of months of my term.
okay,
And then his official term would start in October.
okay.
Kind of like we did when, well, a couple of you weren't here, when Brenda left early. So I was appointed to finish out her term and then start. So big exciting news.
Well, congratulations.
Thank you,
Wish
thank you,
you very much.
thank you.
If I think of something, I'll let you know.
Okay,
Thank you.
If you don't mind, I will give Phil a call to see if there's anything
That's fine.
he would suggest we add on here. In looking at all this, you know, I'm not qualified to add to it or take off. Even though I've been involved in auditors all my life.
Anybody have a problem?
But I did touch base with Phil.
I don't have a problem, but I imagine Karen's probably pretty well covered everything.
I bet she has
She's
to.
pretty thorough.
Yeah. Looks like everything's there.
So with that being said, we're running a little behind. Does anybody need a break? Okay. We'll break for 10 minutes here, Bobby. We're gonna break for 10 minutes.
Yes, sir. I'll keep signing.
As soon as, I'm gonna go back up to the office instead of asking to, go into executive session. I've got a couple bankers up there. So I'm gonna go entertain them if when y'all return into the regular meeting, just head on up there whenever you.
Well,
Does Wade need to be here for your,
I'm not asking for any action, just longer views.
just an update?
I think I prefer if you just come back here in 10 minutes and request an executive session.
I can do that.
It's just more transparent.
Yes, sir, I'm gonna go entertain just for a second.
I understand.
You've already done the special issue stuff, right?
Yes, sir.
So it can go,
Yes, sir. How was Isla?
I'm good, thank you.
Do you have something you wish to share with us?
Nope.
I just want to make sure I recognize you if you did.
No, I didn't. I came to talk to Bobby earlier.
Pardon me?
I came to talk to Bobby.
So what do you think of our economic development director?
I'm hoping he does a good things for us. We needed it.
I
Some
think he
people
will.
don't think we need it, but we need it.
I tell you what,
I think
you
he will.
know, he's been putting in some long hours.
I think he's what we're looking for.
I called him at 6 o'clock one evening, thinking he was already off work, and he was just leaving the office.
I think he'll do good things for us, maybe.
We gotta have growth.
Bobby had to step away for a short, trying to make sure he was back in 10 minutes. Asked him to be back in 10 minutes. So since we're all here and while we're waiting, so Darrell, again on the ag extension, asked me, he feels that he does acquire like engineering fees or whatever. Just bring those to us. Okay, we did agree that we're gonna do this and that was gonna come from.
Yep. I damn sure do.
Capital improvement or what?
Very happy.
Community, one of the two.
Capital.
Appreciate it.
It was a building.
Okay, all right.
Could be the best place. There's $8 million sitting in there, so.
Well, he was gonna get on with the city to see who actually owns the existing building now. And then again, wanted to proceed with demo after the fair. But I told him, you know, they advertise in the paper, just so that every local contractor has the opportunity to bid on the demo, so.
I just want to make sure that the county has the building after it's done. You know, if we do go through, I just want to make sure that the county has a say in the property, that the building sits on it. I mean, I know the county and the city works together well, but I just want to make sure.
Right, now, I believe that's the discovery they're on, the path they're on, to make sure everybody knows exactly where everybody sits. Yes, sir, Bobby.
Yes, sir. Good morning.
Good morning.
I would request that the commissioners go to executive session for about 30 minutes for loan review under the revolving loan fund. I expect no action to be taken.
Yourself on the board.
Just yourself and the board, correct?
And there will be 4 additional people inside the executive session. They're bankers, and they're there to discuss trade secrets of corporations.
Do we have to have names?
I
I think we have to have names so that everybody will know who is in that.
Brenda Klubeck from Central, Karen Skillman, accountant.
Karen Spillman, what?
Karen Skillman, accountant. Walker Trimble from Central National
Citizens.
Citizens. and then Carrie from Citizens.
Terry Collins, good.
Carrie Collins.
Okay. So Bobby's made a motion or asked for executive session.
I'll second.
Any further discussion? All in favor, say aye.
Aye.
We'll go in at 10:18 for 30 minutes. We're running behind just a little bit, Sheriff, sorry, but what we do best. Is that good?
Okay, thanks.
So where is that zoning permit? That's the one, the copy that exists, right? Yes.
Did they get you what you needed, Mark?
Yep. Perfect timing too. Just left there a second. Guess they're busy there.
It's busy.
Jail.
It's very full.
Yep. Saved a little bit of time. Sometimes when you got a bunch of people on the phone, it takes a while.
Yeah, somebody called this morning wanting to lease some beds and they can't. In fact, we're looking for beds ourselves.
See, last week, it was really busy too.
COVID's over, back to full strength.
The dispatchers include on that, random. The Gary's dispatchers. Okay.
Like, everything.
That is what was gave to us from the hospital.
just.
That's fine. I pulled it down in my book, but I don't know if that's what I'm asking for or not.
Probably got that somewhere.
We can probably do it, but that's,
You probably maybe. No, these are just a regular budget.
just regular, okay, that's all we received.
We're back. Running about 20 minutes behind. Thank you, Mr. Johnson, for being patient. We're ready for you.
Morning all.
Good morning.
Here to talk to you just a few minutes on the jail judicial center project. We are at the point, spoken to you in the past about getting some bore drilling done, testing for soil samples and rock at a proposed location. We have that request, as I spoke to you before, in your book. I gave you those requests or those bids that Larry Goldberg and Goldberg Associates put out those bids. And he requests that Terracon Services came in $7,700. PSI came in at $8,520. So he's requesting, or I guess asking us for a request for approval for Terracon to do that drilling. I gave you all the documentation that I have gotten, and there is a page back here that I can show the chairman where I need a signature, just so they can go ahead and start that process. And so that's what I'm here today to do, is just get that approval to go ahead and do that. We have spoke about it before, and you agreed with me to do this. This is just the official proposal for us to go ahead and begin.
Where is that in here?
Right here.
That's
Page, yeah, well,
So it's page 2 of 2, but also reference 3 of 20. It's not, it's about halfway through the packet, Bob. Maybe an arrow halfway.
Basically, these things are necessary for design of the project, so just to know what we're up against ahead of the game before.
you don't want to buy the property and find out there's even put a rock in it.
Exactly.
Correct. That's the only reason, and the soil sample will be if they can maintain a basement or anything else, or a structure on top of the slab.
That probably is the biggest issue. I doubt rock's an issue, but the soil quality might be an issue, right?
Yeah. I would move to authorize the chairman to sign the contract with Terracon for the proposed project.
All second.
All moved and seconded. Any further discussion? All in favor, say aye.
Aye.
Motion passes.
I don't think that's our first.
You'll just sign this one, sir. I'll use that as my original, and I'll give Andrea and Denise a copy of it. And they'll get it back to them.
Don't know if it's our first step to this project, but it's an important step.
Yeah, we've been doing a lot of steps.
We've been doing a lot of
prior to
steps.
this, but,
A lot of dancing.
yeah. Yes, sir, a lot of dancing, a lot of
You
traveling.
can't put that structure up without this.
No, you can't. Nobody's gonna do that without having a soil sampling and a rock test, so. That's all I have, gentlemen, unless you have something. We did purchase our, vehicle from the wreck. You know, we got that taken care of with the insurance company. It's already on the road. We picked it up last week. So I appreciate all your effort and getting on with me on that. But, other than that, we're busy. We're full in the jail. We've got some people call this week and this weekend and want us to house some of their people, and we don't have room. So it's, COVID's over with. If you didn't believe that, COVID's over with. Everybody's,
Are we farming any out?
no, if we have anybody else come through, we may have to. I mean, we're full.
But you haven't farmed anybody out for what, 3 months? Been a while.
Yeah, we've been trying to keep people in and out in ways, trying to keep people in and out, you know.
About 12, 15 is all you've been having off and on. I look at that list every week in the paper.
Yeah, so it's, summer's here. So, anyway, if you need something, you know where I'm at.
Just FYI, next week will be along, Larry Goldberg's gonna be here, discuss a few things. I think we're setting him up for like 1 o'clock.
1:30. And believe me, we met with Larry last week. We're ready to take another step. And we've got all the blueprints, we've got everything set up that we want to be able to sit down and explain to you and the public what's going on. We think you'll be very, very happy with what we've decided for a final plan. We're in the process of getting everybody together from all 4 corners of the county to get people together to explain this to them. And I want to have some town hall meetings in every town, libraries possibly, and we're just ready to take this next step. So we want to be able to go with you next Monday and get your approval, get you guys on the head of the horse, you might say, to help us lead this on, and Monday's the time to do it. So sorry if I've kept you, we'll keep you in the afternoon a little long, but we're expecting at least probably an hour Monday at 1 o'clock.
Heads up for everybody, we'll probably have the meeting here and then take a little break for lunch and then come back. Proceed with this.
Lunch on the sheriff or on the undersheriff.
Again, just submit it, we'll take care of it.
It's on you. You can go wherever you want to eat.
Thank you.
Thanks, Tom.
See you, Tom.
Thank you.
See you, Mark.
Sounds good.
Carl, it's all yours.
Carl just, yeah, I knew there was anything on it.
Morning, everybody.
Good morning.
Carl.
We finally get the position description for the radiological officer rewritten. And I'm going to get permission to put an ad in the newspaper, to advertise the position.
Is this required by FEMA or?
No. Well,
Or,
it's highly recommended.
NRC, highly recommended, okay.
When I talked with Katie, and they highly recommended that we fill it with radiological officer advertising. I'll get it spit out in a moment. And I was going to extend the deadline now. I have one misprint on there. It's to July 29th, so we can make sure and get it well advertised. We're just going to advertise it openly across the state so that we can get a correct pool of candidates and bring in the best possible person we could.
I see you don't have any starting salary or anything like that. It's going to be, depends on who the applicant.
As it currently is written in, with the approval of the latest pay schedule you guys had, it'd be at range 15, it'd be at step 1, and it'd be 21.74 an hour.
Do you really think you're gonna find somebody at that that's got the requirements?
I think we will. I think, we'll open it. I think with opening up across the state, that we can maybe draw on emergency. Other people will probably have to finding a radiological officer, maybe a little bit of a challenge. Somebody's already got their certificate, but somebody that's got the experience in emergency management. I feel very confident that we can, because this is a little bit of a specialty item, but there's plenty of retired service people. There's people from Wolf Creek that we advertised also. So I was gonna put the word out among some of the people I know within Wolf Creek organization. If they know somebody that's retired, or maybe there would be somebody willing to come into our program that's willing to work, our hours and with our pay, so that could be a better life for us.
Does this have to be a full-time position?
With everything that we'll be doing in the future, probably yes. Any other questions?
They've got to have a degree, associate's degree in emergency management.
Yes, if they can, or related experience.
What would be considered related experience?
I would look at anything with that get their certifications within emergency management, a broad range of training, concur with emergency management to FEMA schools, or even within National Fire Academy programs.
Okay.
Because we would look at all those certificates and see how they would apply and whether they would fit into that. Because there's also retired personnel like from the National Guard, which were accordion picked up his experience in previous position. Could be looking for positions such as this. I would make sure, like our Homeland Security coordinators would know, so if they had a connection somewhere along the line, like Josh Smith out of Southeast Kansas, who's also covers our area, they know people may have these type of requirements we need, because that's going to reach out to people, make sure it's widely broadcast.
Sounds good to me.
You need a motion for approval, advertise?
Since we're filling an open position, do you really need permission to advertise?
Well, when I asked Angie, she said to approve the request for authorization to advertise and hire for a full-time radiological officer.
I guess it won't hurt anything.
No,
Probably not
it was
necessary.
just to make sure that you guys are in the loop. So,
I'll move.
Jesse's moving,
All second.
Tim seconded. Any further discussion? All in favor, say aye.
Aye.
Motion passes 5-0.
Thanks, Carl.
that's it. Thanks, Josh.
That's our agenda. Roundtable. Denise. Tim,
Nothing.
Jesse.
I don't believe, I missed the planning board last Wednesday. Got in late, so I didn't have anything from them.
Just three quick things, since Denise is here, and you're gonna be gone on the 19th.
Yes.
When do we do our budget hearing? Is there a date for that? We don't do that on the 19th, do
I'm not sure. I think she had, it looks to me like on the calendar, you have budget work sessions the next 2 weeks after the meeting.
The budget hearing will be in August.
we? Okay, so
It's
that's
usually
now-
around the middle of August.
Yeah,
It will
okay.
be in August.
So it won't be on the 19th. When Phil comes in, we talk about our mill levy for next year. That'll be happening, is that in August also?
I'm not sure.
Okay, I just wanted to make sure,
But the next 2 weeks, you do have on the calendar to have a budget work session after your meeting.
and with Karen stepping down in 30 days, I wonder what the time frame is on going through all the channels that need to be for new clerk to be in place.
Treasurer.
Or, I'm sorry, treasurer.
It sounded like it went to the Republican committee, and I would assume that the Republican committee would nominate the
Have
newly elected clerk to go and step in.
But to me, the timeframe,
And I think as soon as they get wind of it, they will start working on it, but legally can't do anything until the governor has authorized it.
the 30
But they
days
will-
is pretty short
But they,
timeframe.
I mean, that's what they did with Karen. They started working on it.
Don't they have to receive a letter from the governor officially?
But I think when Karen took over, they started working on it right away and had pretty well had things in place. So as soon as they could do it, they did it, and it was really not a lapse.
But here we go, 30-day timeframe, much shorter.
We'll
So
see how quick the governor responds then, but
I would say she'd probably respond pretty quick, but how quick does it get to her before it responds?
All depends on the mayor.
So hopefully it'll all work out. I don't have anything else.
Had a shirt in the mail for 2 weeks.
the only thing I had for roundtable, and actually Andrea and I kind of made a list for roundtables, but all basically on the courthouse. You have something, Tim?
I was talking about the lock. I thought Tim had it last.
Okay.
Like,
So,
you always
Go
have
ahead.
nothing. Okay, one of the things is the window locks for the courthouse, or the unlocks in case of emergency. There are only a few throughout the building. So I put out an email on Friday, kind of at the end of the day, to see how many offices need these, how many windows they have, because this is for in case of emergency. This is how they're unlocking the windows. and I can't find this actual tool, so I don't know if you wanted to see.
Actually, this lock, a few years ago, I took some wrenches, on there was 1/2 inch or 9/16, and actually made a couple of those for a couple of different departments. They can be made. I mean, you get like a combination wrench. You've got to heat it and bend it. And I think you have to file them down because they're not quite 9/16 or, but they are makeable.
Okay.
It might be something, somebody from the shop or somewhere might make them.
Okay.
Or we can contract with someone.
So let's find somebody to make us some.
Okay, that works too.
If we do make some, is there a way a person can attach them by the window on a cable? I mean, like,
If you use a combination wrench, you got a loop on one end.
Yeah. like an actual cable?
Right, because right now, the way this sits, if there's one in the window, this just kind of sits right in there, so it stays in there, so in case of emergency, it's already sitting there, and all they have to do is turn it, because it rests right in that.
Right.
So that's what, are you saying, keep them all so that they can't possibly,
Disappear.
just, yeah.
Well, on
Okay.
the end of the hex head, why was that in there? The other end is a hex head.
I bet it's a multi-tool for something.
I wonder, what does that do? Allen wrench head.
I don't know.
It looked like it actually tightened the lock on the window. If you turned it, it made it looser or tighter to unlock the window when you twist it.
See, that's what I wonder. A guy might go ahead and get whatever size Allen wrenches those are.
Well, but usually the windows, you could go around and adjust those. That's not something that's going to change.
All right.
I mean, very honest, I would say probably the change would be the people who actually open their windows quite often. But you could take the wrenches we have and probably adjust those. The other part would be, but they're doable.
Starting point to get somebody to make these would be has anybody got an idea where to start?
I'd just start with the file when the building was built, see if you can find the original ones. Those files have got to be here and readily accessible.
Since 60s.
Yeah.
I guarantee you, those files are here, and they should be readily available, because you're dealing with a fixed asset.
I bet you they'll let you go look for them, Don.
I looked on the internet and I couldn't find anything that resembled it anywhere close, just in 10 minutes. So I think it's gonna have to be made.
Well, again, a company, anybody got an idea?
I don't know, I think anybody could do them, because to be honest with you, Sam Hiner and I both made a couple at the same time.
I bet the Road and Bridge crew would get that. I bet they would get that.
But we took them, I think it was 9/16, I don't know for sure what size it is, either 1/2 or 9/16, but we had to file it down because that's an odd size. You just heat them, bend them, and you're done. Maybe a rainy day, maybe road bridge guys.
Let's check into that. I don't know. I'll think about it. We can check in on it.
I mean, it'd be great to find somebody that's got a CNC machine.
That's why I
I don't
asked
know
the
who
question. I
has a
mean,
CNC
there's gotta be some
I mean, I know there's
shop
one
out
before
there
you.
somewhere that could actually just make these mass produce them instead of waiting for a rainy day.
Maybe D. Francis. I don't know what he does. He has a shop.
Yeah.
I'm trying to think of people who have shops.
Well, I myself am thinking of a regular shop. I mean, not against shopping local here, but I mean, I would assume some of this has to do with that, that evaluation.
The Alice training.
Alice training. So I mean, since the Alice training, we had a list. Where my list would be probably upstairs in the file cabinet of things that needed to be addressed and done, like some coded locks on some of these doors. And I don't know where that's been,
Well,
where are we on that?
since you mentioned that, and since Brad is back, and if I wasn't gonna ask because Brad wasn't here, but how are we doing on the lock on the back door?
I have a new vendor I am ordering it from as soon as I can get some paperwork signed to get a new vendor.
So I guess what I'm saying is that list, and I guess I need to just go upstairs and look for it, of things that need to be addressed, like, well, I probably shouldn't say a whole lot, I mean, there's several things, I don't know if any of it's been
Done.
thought out, no. As well as, I don't know, we talked once about the, getting the courthouse, virus friendly, so to speak, with the HVAC bids. I don't know where that's at either. Do you know?
I think it needs to just be started.
Okay. So with that being said, I'd like permission, I guess, to have Andrea contact Modern Air and anybody else, because we did have,
Wasn't all that coming through somebody else? This hospital, or not the hospital, but the courthouse? Wasn't that coming through some study?
Yeah, it came through,
Goldberg.
Goldberg.
But we did, if I remember correctly, and anybody can correct me if I'm wrong, that Angie did get a scope of work from Modern Air, and we decided that the money amount was up there enough that we needed to seek out bids, but we needed to,
I think Goldberg just recommended that it be done. And then Andy went to Modern Air and had them come in. And I thought we agreed, yeah, we'd have them go ahead and do some of it. Well, I thought we had put it out for bid, or we're going to have it drawn up.
Because you abstained from it. I thought.
Okay.
yeah, if I remember right, there was supposed to be a scope of work drawn up so it could go out for bids. So I guess we'll be back to square one on that one, I guess. But, and then as far as the Alice training deal, like I say, there was several, not major issues, but minors on certain doors and this, that, and the other that needed to be addressed.
I wonder if, since evidently these locks on these windows are outdated, I wonder if there's not a new replacement lock that would be just as quick and easy and not any more expensive to just replace the lock on those windows.
That would be a window company or a door company, probably expertise more.
Just open all those up and use a twist lock or something. You know,
Yeah, I mean, I wonder if that wouldn't be an easier route to go, because it seems like these handles, a lot of them have been lost over the years. But Brad is working with the door company for that door. Maybe you could bring that up to them about the windows.
Yeah, I could ask.
They'd probably have a better avenue than, or a better idea than us,
Yeah.
my guess, so that'd be great.
Oh,
My theory is an emergency, the chair goes to the window.
Well, that's true. True.
But we don't want to do any of those during training.
Yeah. There's something else?
Just so that everybody knows, those were the two things, and then the mail machine should be moved to the back of the appraiser's office mapping room by the end of the week. So that was my other thing on that, yeah, the HVAC, the windows, and the mail machine.
That was my round table.
housekeeping.
Anything else?
No,
Anybody else?
Everything gets signed?
Everything signed? Okay. We will adjourn at 11:15.
Thanks, Tom. Thanks, that's early. We'll just stay later
Don't
next,
count on it next week.
we'll just stay later next